Our Facebook Live presentation on mental health, suicide prevention, and in-person learning. We are joined by Dr. Ajit Jetmalani, Director of Child Psychiatry at OHSU and a consultant for OHA, Kahea Reichman, School Suicide Prevention and Wellness Program Manager at Lines for Life, Amber Ziering, Project Manager at Oregon Pediatric Society, and Liz Thorne, Director of Matchstick Consulting. After brief presentations, we will open it up to questions. To ask a question, please submit your question in writing in the chat section. So with that, we'll let Dr. Jetmalani kick us off.
Thank you, Jonathan, and hello, everyone. First, I wanted to start by giving a quick update on the state's COVID outlook. Our latest COVID forecast estimates that the transmission of virus increased in December, but has declined in recent weeks. And if the current level of transmission continues, we expect to see daily case rates below 200. The presence of the new COVID variant, however, remains a concern. So while access to vaccines gradually expands throughout the state, we need to continue practicing preventative measures to slow the spread of the disease. Keep maintaining physical distance when you're out and about. Wear a face covering or mask. Avoid gatherings with non-household members, and practice good hygiene. Remember, getting rid of this virus will be the quickest step towards our getting kids back in school fully. Many thanks to all of you for joining this conversation. We are now at a year of coping with this pandemic, and we'd like to share information about suicide prevention efforts in Oregon and acknowledge the hard work all of you have done to cope with the challenges of this extraordinary circumstance. During this past year, Oregon's children, teens, young adults, parents, educators, behavioral and physical health providers have all had to pivot to try new ways of learning, teaching, working, helping each other, and surviving while holding on to a focus of wellness the best we can. Today's conversation is particularly focused on suicide prevention. And whenever we talk about the topic of suicide, we know that many of you may have personal life experiences, and those conversations can be difficult. So we want you to know there's effective resources to help you right now if you need that help. And you'll see that information in the Facebook Live posts. Suicide is a persistent problem. Oregon has consistently had higher than national average suicide rates for over a decade. The problem's been here for a long time, and it continues to be a problem. In 2018, Oregon experienced its highest suicide rate in history, but there is cause for hope. Youth suicide, which represents youth ages 10 to 24, decreased in 2019 for the first time since 2015. And based on preliminary data, OHA expects to see an additional decrease in youth suicide deaths in 2020. The first 2-year decrease since 2008. We're going to link a few data sources in the chat for you regarding this information. This has been a difficult year, and yet suicide in Oregon has not increased during the pandemic. The reasons that somebody dies by suicide are always complex. And so our work of suicide prevention must also be creative, comprehensive, and relevant across cultures and age groups. As our children and families face another transition with schools pivoting to in-person or hybrid learning, we'd like to spend time today highlighting 3 ways in which Oregon's suicide prevention efforts have been responsive to the unique challenges of the pandemic. This work, of course, is not done. We'll remain laser focused on suicide prevention for our state and work to tightly hold on to the progress we've made into 2020. We have a strong team of prevention champions, and we've set ourselves as a leader in several key arenas of suicide prevention. 3 of those champions are here today, and there will be a link in our chat to the youth suicide prevention programming that we have across many arenas. We've built a robust prevention program, including human and financial supports for schools, communities, and other youth serving organizations. And the three initiatives represented here today are just a few pieces of the larger picture of suicide prevention in Oregon. In every county in our state, local champions are working hard so that we do not ever have an experience like we had in 2018 at its peak. You know, one of the things that I found as a child psychiatrist is that there are a couple of tips I wanted to give you all while I have this chance. One is that really children sometimes make these decisions to harm themselves in moments, in minutes or seconds. And if we can reduce access to lethal means like pills and firearms, we can prevent many of these events. So please lock up your firearms, lock up your medicines. The other thing I wanted to mention is that on many occasions, children that I've interviewed who have attempted to harm themselves have done so in the context of having had their communications pulled away from them during a conflict with family. What I would recommend is that if you have troubles with communication and electronic utilization, please have a conversation with your child. Do not rip away their access to their peers, for that may be their one resource that they seek when they're in a crisis. I would like to move on now to our other three panelists. And first, I'd like to start with Keahi, I pronounced that incorrectly, who will begin to talk about our suicide prevention and wellness teams at Lines for Life. Thank you.
Thank you so much. And yeah, my name is Kahea Reichman. I work at Lines for Life, which is a statewide nonprofit focused on suicide prevention, substance abuse prevention, and promoting mental wellness. Particularly my role at Lines for Life is as the school suicide prevention and wellness program manager, which means that I work with schools across the entire state, helping them with their suicide prevention, intervention, and postvention policies and procedures. There was a law in Oregon passed in 2019 called Addie's Act, which requires every school district in Oregon to have policies related to suicide prevention. And our program is a team of 5 people that work across the state in different areas to help folks write these plans, edit these plans, grow these plans to help meet the needs of their students. So far in our program, which launched in April of 2020, we've talked to 94 different schools, school districts, and education service districts in our state and supported them with their suicide prevention efforts. We've also distributed a total of $115,000 in grant funding to different school districts across the state. And this money will pay for things like new student curriculum about suicide prevention in places like health classrooms, staff training and suicide awareness and supporting young folks at risk for suicide, and physical wellness spaces in schools for young folks to de-stress and seek support, along with a variety of other efforts that we've been able to support schools in funding this year. We have a huge regional focus on our team, which means that we're doing our best to be culturally responsive in different rural, urban, suburban, frontier areas of Oregon to make sure that they have a suicide prevention plan that works for their school communities. And if I could give any tip for the folks watching right now, I think that when you're working with the young folks in your life that you care about, it can be so important to model that we as humans, as adults, we also need to regulate our emotions and seek mental health support when we are struggling. And so I think having these honest conversations with young people that we care about saying things like, I'm feeling really stressed right now. I think I need to take a moment and take some deep breaths can be such important modeling for them taking care of themselves and being able to gain those skills in regulating their own emotions. And I would love to pass it on to our next panelist now.
Hello, I'm Amber Ziering. I'm a social worker and the project manager at Oregon Pediatric Society. I'm also the lead developer for youth suicide assessment in virtual environments, also known as Youth Save, which equips youth-serving mental health providers, both in schools and in the community, to do the important work of suicide assessment and safety planning in the context of COVID. Thus far, 868 school and community-based counselors, psychologists, social workers, and behavioral health providers have registered to take Youth Save, and 227 participants throughout the state have already attended. Youth Save encourages parents and youth serving professionals to ask the youth who we're concerned about if they're having thoughts of suicide. If they say yes, keep the conversation going and respond with calm and grace, even if you're not feeling that internally yourself. Taking the time to really listen, being present with them through the difficult times, and collaborating on a plan to find their personal resiliency offers the youth hope. Asking the question doesn't put the idea of suicide in their head, but rather lets youth know somebody cares enough to ask about the hard things and to connect them with extra support if they need it. All right, with that, I'd love to pass over to Liz.
Thanks, Amber. Hi, everybody. My name is Liz Thorne, and I'm Director of Matchstick Consulting, and I oversee strengths-based and upstream suicide prevention programming in schools statewide through sources of strength at the elementary, middle, high school, and university levels, as well as 5 Radical Minutes. And this work is funded by the Oregon Health Authority, done in partnership with these fine folks alongside me here. And when we say upstream suicide prevention, what we really mean is focusing on building trusting relationships between young people and adults, normalizing help-seeking behaviors, and being able to name our own individual and our family, our community, our school strengths, so that people know what helps them calm, what helps them cope, and what helps them connect, so that nobody feels too overwhelmed by the stressors or big emotions that we will all face in our lives. And in this past year, we have partnered with over 40 middle schools and high schools across Oregon to start, to sustain, to maintain these practices in their school environments, whether that's a Zoom room or a physically distanced classroom in a hybrid setting. And I think the really important thing that I want to convey to you all is having a trusted adult is such an important and powerful protective factor for young people. And so we're going to drop a link in the chat with some resources from Sources of Strength to help you start a conversation and start a practice of inviting conversations around what helps us with young people in your life. That can happen in the car, at dinner, on a walk, via text, whatever it might be. And so we really hope that that can be a resource for you to take, and then to lift up what Kahea said about checking in with ourselves too. I'm a mom of 2 school-aged young people. So being able to identify what are the supports for you, who are the people, what are the practices that are helping you get through hard times. And with that, I think I'll pass it back to Jonathan.
Thank you, everyone. We'll now open it up to questions. Just a reminder, this is a Q&A on mental health, suicide prevention, and in-person learning, so we won't be taking questions on other topics. Again, to ask a question, please submit it in writing to the chat section. Our first question is from Cassie. What about parents who are struggling too? Liz?
Yeah, I'd love to take that. I think the thing that I would say, I mentioned the resource document that was dropped into the chat. There are practices, and I really encourage folks, as we talked about, to model practicing self-regulation and coping for yourself. So identifying who are the people, who are the family members, who are the positive friends, who are your mentors, what are the activities that help you as a human being connect. There's also a network of resources available through the Oregon Family Support Network that a link will be dropped into the chat. And so I invite folks to take a daily practice of practicing those activities that they know help to fill their cup so that you can fill the cup of others. But that is not to say that that is a replacement for accessing mental health supports and services that people need and that people deserve. Thank
you, Liz. The next question comes from Kira. What about people who make too much for Oregon Health Plan, too much to be on a sliding scale for low income, but can't afford to see someone? Dr. Jet Milani, you want to take that one?
You bet. That is a really difficult problem to fall in that gap. And I'm sorry you're in that position. I do think that there may be resources to find on the Safe and Strong website that you can follow to seek other alternative strategies. You might want to consider reapplying for OHP if your income has changed. And the other thought is that, or other thing to tell you about is that OHA in the next short while will be coming up with a website that will help match people who are needing services to providers across the state. And that's one of the beautiful things about virtual care, which was maybe the only good thing about the pandemic was that we developed faster for virtual care, is connecting with a provider anywhere in the state who may be able to offer you resources at a rate that you can afford.
Thank you, Dr. Jet Milani. The next question comes from Christina. How are kids supposed to get socialization they need to support their mental health if in-person instruction isn't going to be full-time?
Yeah, I could respond to that one as well. You know, it has truly been one of the greatest challenges of all the challenges we faced, is that children are very oriented around their social interactions as part of their development, especially teens. To not have that when their brains and minds are oriented around that has been a deeply difficult thing for people. It's an enormous leap actually to go from no physical contact or presence with others to having a few hours or a few days a week of doing so. It's actually a big jump. And I suspect that kids who are really yearning for that are going to find a significant boost. The other thing is to think about other safe ways to get together with peers. Certainly, thankfully, we're leaving winter, getting in closer to spring, and being outdoors is a very safe way for people to be together. And I think we'll find that folks will experience even those short amounts of time in school as an enormous benefit. But you're right to have concerns about that for little ones as well, who hopefully will be the first to be in person at greater lengths of time in the classroom in the coming weeks.
Okay, is there anything you wanted to add there?
I don't think so. I think that Ajit handled that wonderfully. I think that it's just so important for us to continue to advocate for the young folks in our lives and to ask questions and to be thoughtful about the different ways that this is shifting in our state. As we move forward, things will continue changing, and I think I feel hopeful about the direction that we're going.
Thank you both. Gina asks, are there extra mental health supports for middle and high school students?
I can take that one.
Thank you.
So the really wonderful thing about Addie's Act passing through the state legislature is that it is mandating that schools make sure that they are adhering to best practices around suicide prevention, intervention, and postvention. And it's also increased a ton of resources for schools at this time as well. And so one of the big examples of that is that we have been able to offer for free or low cost a lot of different staff trainings for schools. So staff members that, like teachers and social workers and counselors, have been able to access training to help them sharpen their skills around suicide awareness, asking the question about if somebody's having thoughts about suicide. And we've been able to support that financially, but then also support the actual logistics and planning for that, since my team at Lines for Life is focused on supporting schools in whatever way they need us. We can talk to them about different strategies to make those trainings happen or to help them in that moment. I also think that ODE, or the Oregon Department of Education, has a really helpful mental health toolkit that they recently released. I think that they'll drop a link in the chat to that. It's worth a read, and I think that the resources mentioned by Liz on the Sources of Strength website is also really helpful to just continue to keep yourself aware of different resources that are available for schools and for families right now.
Thanks, Kahea. Tat asks, are you going to cover strategies for children based on age? Liz, do you want to take that one?
I'd be happy to start that off. I think the thing that I would want to share from at least a sources of strength perspective, if you take a look at those resources, you will see what we call the sources of strength wheel with 8 protective factors or strengths. And these translate across the age spectrum, you know, from family support, whether that's your biological or your extended or your chosen family, to positive friends, to healthy activities, generosity and spirituality, as well as physical health and mental health. And so you can have a conversation with children as, you know, even with my 4 and my 5-year-old, we talk about emotional regulation and what do emotions feel like in our bodies. And so that we can start to pay attention to when we're coming up with a big emotion and then turning to what is going to help us. Shifting the conversation from what hurts to what helps, particularly during a time of big transition, like we are experiencing, shifting back into either more in-person learning or a different schedule or set of in-person learning. And so just talking about those emotions that are coming up and figuring out what are those practices that are going to help keep us connected and coping in a safe way. And again, I can't emphasize enough that this is a daily practice and a daily conversation. It's not meant to be a one and done conversation, but instead really relational and built over time.
Thank you, Liz. I'd love to amplify on that. When really struggling, there's 3 basic things. You can cope, you can connect, or you can distract yourself. And those distractions across the age can be very different. Maybe making a batch of cookies is exactly what your 6-year-old needs to do with you. And perhaps that is the distraction technique. You're not talking about difficult things, you're just spending time. That's actually distraction and connection together. Think about what your child is interested in and think what distracts them in a positive way, or who do they connect with? And that can change again, according to their age and maybe even who they're feeling connected to lately. Maybe they're very connected to grandma, or maybe they have a cousin they haven't called in a very long time. Those kinds of things can help depending on the age.
May I add to that? Those are great responses. I think the other thing to think about is our perspective. I love the fact that you asked that question about the age of your child, reflecting that you understand that different ages require different things. And oftentimes children, teens, young adults may present with a set of struggles, and how we interpret those struggles leads to our decision about how to try and intervene or support that person. And so thinking from that perspective, that when children are struggling, is typically not because they're choosing to struggle and wanting to make your life difficult, but their skills aren't meeting the demands of the world around them. So when you think about a small child, that may represent something very different. The struggle may be very different than with a teen. And just thinking and reflecting and presenting as empathetic when your child is struggling set the stage for them to be calmer, because they see you are calm, you're curious, and you're wanting to sort this out with your child, regardless of their age. So using that universal practice set the stage for conversation, and then together finding solutions to problems that at times are very daunting.
Really quickly, I'd love to add, apologies, Jonathan, just for the preteens and the teenagers in your life, one of the resources to keep in your back pocket is our youth line at Lines for Life. And so our youth line trains peer workers who are always supervised by crisis trained clinicians to respond to text chats, emails, and phone calls from young people in crisis every single day of the year. And so from 4 to 10 p.m. Pacific time, our young folks are responding to their peers, helping them through any sort of crisis. No, we don't define anything as too big or too small for the youth line. And so we talk to young people sometimes about how frustrated they are that their parents want them to clean their room, versus we also talk to young people who are at active risk of suicide in that moment. And so our crisis line exists to meet wherever that young person is, where they are in that moment, and help them get connected to resources and also talk to a supportive peer.
Thank you, everyone. That's great information. This next question is from Lily. Bullying is out of control, and we must educate parents not to allow their kids to have unsupervised technology. What else can parents do? Dr. Milani, do you want to take them on?
Yes, I might reference Screenagers, which is a wonderful documentary that was talking about youth access to electronic media, bullying, and in relationship to their parents, and how to navigate an incredibly difficult topic. Their website also has guidances for how parents might set up a strategy to manage electronic media. Bullying indeed is oftentimes an event or an experience that precedes self-harm. And so I think you're right to call that out and wonder about it. And online bullying happens easy. Adolescents are impulsive, and they do say things quickly that can't be retracted online sometimes. So I would say that making sure that your child knows, first of all, that you have a contract with them in the beginning when you give them a cell phone of how it's going to be used. If it's too late for that, talk to them about how you've observed that they're struggling. You'd like to develop a different strategy. You know how important the electronic media and access to friends is, and you understand that, and you want them to still have access, but that you want it to be a safe place. And then negotiate with them. Maybe it's going to be reducing the time, and they hand you the phone for a few hours a day so they can focus on work. Please look at the Screenagers website for really detailed descriptions of how to navigate that. I think it's a great site.
Thanks, Dr. Jetmalani. Fernando has a comment. My mom just passed away from COVID-19, and I'm feeling very depressed.
Fernando, I am so sorry for your loss. It's always incredibly hard to lose a parent, and then to do it during a pandemic where other things are so different as well. Thank you for sharing with us about your loss. I appreciate that, and I appreciate your bravery to tell us about that. One of the supports that is available for you is called the Dougie Center, and the Dougie Center focuses on supporting families through grief and loss. And I hope that you might be able to reach out to them or to one of your teachers or school counselors, or if you have a friend or a family member to just talk to, not necessarily fix things, but just to have a good memory of your mom, or to just talk about those feelings during that time.
Thank you, Amber. And this is the last question from Janica. What is OHA doing to help these students have access who might need extended care? And how can parents get their children counseling, especially when insurance will not pay for it?
If your community has access to a school-based health center, oftentimes those school-based health centers will have not only physical health resources or dental health resources, but also mental health and behavioral health resources. And in my experience, living and working in a community with a school-based health center, your children don't necessarily have to attend that school to access care. They just need to live in that community. And in my experience also, those centers offer free or low-cost services for folks who can't pay for it. And so that's a really good first step, to reach out and see what your school can help you with, or a school in your community can help you with. And then I don't know if any of our other panelists have other resources that came to mind.
I would just add to that, Kahea, to check in with young people's school counselors, school counseling offices. With the passage of the Student Success Act, there has been a large increase in the number of both school counseling positions, school social workers, and partnerships with community-based mental health providers. It's still a huge challenge, particularly for those who are underinsured or, might not qualify for OHP, but can't afford the cost, or insurance doesn't cover it. But I would encourage reaching out to folks at the school to see how you can get support there.
Well, I just want to thank everybody for attending the session. This is a difficult topic. Again, if you need support, please look in the chat to find access to help right now if you need it. And thanks for having this conversation. This is how we're going to continue to make things better for kids, is having the conversations amongst us and implementing these programs that Oregon has so robustly invested in.
Thanks, Dr. Jetmalani. Thank you all for joining our Facebook Live discussion today, and have a great rest of your day.